My role is to look at welfare and particularly look at income maximisation within households and to reduce inequalities, and poverty being one of them. So the model was delivered very much based on the health setting model, which was that we embedded a worker within schools. So we tried it in one school for free, and that was for 6 months, and the results of that were extremely positive. So we then looked at rolling that model out to being in a cluster within a group of schools in Edinburgh. Any of the children that go to the school, any of their parents or their carers are able to access that service, as well as staff are able to access the service as well. Because one of the things we're very aware of is that lower paid staff within council settings very much can be struggling and be in work poverty. So they as much were able to access the service too. The secret to it is relationships, and it's building up a relationship with all the staff, from the head teacher right down to the cleaners, that everybody's aware of what the service is and how they can access it. And it very much was a self-referral system, as well as there was some appointments if that was helpful, but there was flexibility in there. And the success of it working around the relationship was if they got invited to the Christmas party, that they had very much worked on the relationships and were able to see that they were embedded. They also worked with the staff in terms of attending parents' evenings, for example, or any events like Christmas plays that were going on, for example. They were able to then go along to them and publicise the work that we're doing with the parents as well. We have one family, for example, who we were able to gain £18,000 for. This family came to the advisor under the remit of wanting to claim free school meals, and they weren't able to access them. Could the advisor help them? And that advisor was able to open up the conversation, build up the relationship enough to find out what was really going on. And what was really going on was that that individual was unable to claim their benefits due to language barrier, and so we were able to assist them in claiming for housing benefit, for council tax rebates, prevent homelessness because they were in debt due to rent arrears, and also assist them with furniture. For example, the house had no furniture in it, the children were sleeping on the floor, so they were able to do as much as they could, gain the free school meals as well, and the total for that one family was 18,000, and that just started as an application for school meals. So it's about opening up that conversation. As a whole, we've worked with, for the first 10 months, we worked with 61 families, and we gained £275,000. On average, that's roughly about £4,500 per family. So the key partners that we use to provide the income maximisation, ourselves around the table, so NHS Lothian as a public health practitioner, the council, the 1 in 5 programme, as the structure and the framework that allows for us to get into schools, if you like, and also our third sector organisation, Community Health Advice and Initiative, CHAI, in Edinburgh, who provide advice services as well as housing advice. I think it's a model that's very effective. I think it targets families specifically, and the families that we've certainly targeted have been families that wouldn't normally attend advice services. I think in terms of sustainability, we're in a place moving into another stage of this project where it's not just about looking at financial gain, but it's about looking at long-term prevention of poverty and moving families out of that. And that's about adding in family support and also employability services, so that we're working as a whole family unit and taking a holistic approach. Kids aren't just about kids, they're about their parents, they're about the whole unit. And I think taking a whole unit approach is really, really important. And as an NHS provider, I think taking a partnership approach allows us to meet all those needs, because as an individual organisation, we can't do that. And I think that for the families, they get a full package rather than just bits that they have to try and grasp in different places. We're actually bringing a package to them which actually meets their needs and makes a difference.